Hi, my name is Sarah Chamoun with the University of Memphis, health assessment head to toe, and I'm going to get started by scanning the room. Okay, so there's my Snellen chart. There are my tools, and we are in an ICU room. There's my patient, and there's the floor. Her shoes. So I got everything. Okay, so I have already performed hand hygiene and verified my patient's identity. So I'm going to get started by just saying that throughout the entire assessment, I'm going to be inspecting her skin on her upper and lower extremities, her abdomen, her posterior anterior chest, and her face and neck, just for any scarring, nevile lesions, bruising, for the moisture, skin integrity, the texture, turgor, and temperature. So we're just going to start from the top and work our way down. So we're going to start at her head. Just upon inspection, her head is midline and symmetrical. Starting with palpation of her head, her hair is smooth and blonde, and the distribution of her hair is even. There are no indentations, infestations, no lesions or tenderness on her head, and start next by palpating the temporal arteries. Do you have any tenderness? No. Okay, next I'm going to palpate the lymph nodes. So we're going to start by palpating the preauricular, postauricular, occipital, tonsillar, submandibular, submental, and then supraclavicular, and then also the anterior cervical chain and then the posterior cervical chain. I'm just going to put my hands on your jaw and feel clench. Okay, so that's the motor part of cranial nerve 5 intact. You'll open your mouth and kind of move your jaw side to side, and that's kind of just testing the TOJ to see if there's any crepitus or tenderness, which there is not. So the second part of the cranial nerve 5 is I'm just going to have you close your eyes. I want you to tell me where on your face that I'm touching. Perfect. So the cranial nerve, the sensory part of the cranial nerve 5 is intact. Next we're going to do cranial nerve 7. So you'll just raise your eyebrows, poke out your cheeks, smile and frown, and poke your lips. Perfect. So that's the cranial nerve 7 is intact. We're going to move on to the ear, to the ears. So the ears are symmetrical both sides, palpating both ears for any tenderness, masses, lesions. There doesn't seem to be any abnormalities of the ears noted. Do you have any tenderness? No. Okay. I'm just going to look at the tympanic membrane with my otoscope. Both ears, at the auditory canal, and it is pearly gray and translucent. So we are going to test your cranial nerve 8, and I just want you to plug that ear for me, and I'm going to whisper something and you tell me what I say. 1, 2, 3. 1, 2, 3. Okay, and do the other one. ABC. Perfect. And then if you could just tell me if this is equal in both sides. This is the Weber test. Or is it louder in one or the other? It's equal. Okay. And tell me for the Rennie test when you stop hearing this. Okay. Can you still hear it? Yeah. Okay. conduction is greater than the bone conduction for the cranial nerve 8. Next we are going to be moving on to the eyes, just inspecting the eyes, the lashes, the brows, the palpebral fissures. There are no obvious discharge, lesions, redness, or anything noted on the eyes. I'm just going to test the pupillary response to light. If you'll just look straight ahead. Testing the direct and concentric response to light. And then if you can just look at the tip of my, look at the wall, and then if you will just look at the tip of my pen light and follow it all the way in, and then look back to the wall. Perfect, and that's the accommodation test of the pupils. And if you could just follow my finger without moving your head. Perfect, and there's no nystagmus present there. And then on the Snellen eye chart, if you could cover one eye and read the smallest that you can see.
LTFPH.
Okay, and the other one?
LTFPH.
Perfect, thank you. So from examining oh, and then also, sorry, I need to do your peripheral vision. Just look right at me and tell me when you can see my fingers.
No.
Okay, perfect. So peripheral and central vision, cranial nerve 2 is intact, and then cranial nerve 3, 4, and 6 are also intact by testing the pupil's reaction to light and the accommodation. Next, going to look at the internal structures of the eyes and the red light reflex with the ophthalmoscope. Okay, and internal structures of the eyes are intact. So, all right, next we're going to move on to the nose. And so inspection of the nose, it is midline and straight on her face. And we're just going to check for patency. So I'll just have you occlude one side and just kind of breathe in and out. Perfect, and then do the other. Okay, and then I'm going to have you close your eyes, and I'm just going to, I have 2 different scents that I want you to tell me what they are. Perfect. And the other one?
Alcohol.
Great. All right, you can open your eyes. So cranial nerve 1, the sense of smell, is intact. Moving on to her mouth. When I have her open her mouth, I'm just going to be inspecting her teeth, gums, salivary duct, buccal mucosa, her palate, her posterior pharynx, her tonsils, her tongue, underneath her tongue, and then on the side of each tongue, just for any redness or swelling or lesions or anything that may look abnormal. You can just open your mouth and you lift your tongue up and move it side to side. Okay, and can you stick your tongue all the way out straight? And so that's cranial nerve 12 that's intact without any fasciculations. And then if you can say ah. Okay, perfect. And tonsils are graded 2, and the soft palate and the uvula rows symmetrically, so cranial nerves 9 and 10 are intact. So next we're going to move on to your neck. So just upon inspection of your neck, it is symmetrical. Just going to palpate your trachea, which is midline, and I'm going to go back here and palpate your thyroid. If you could just swallow. Perfect. Okay, if you could turn your head that way, I'm going to palpate your carotid artery on this side, and then back this way towards me. Alright, awesome. And then I'm going to just auscultate the carotid arteries for bruise. when I place my stethoscope on there, if you can just hold your breath. Okay, breathe. Hold your breath. Perfect. Okay, so no breathes are present. While we're at the neck, we're going to do range of motion. So we're just going to go flex, if you could go forward, and then extend, and then hyperextend. And then we're going to say lateral flexion side to side, and then rotation all the way around. Perfect. And then I'm going to have you shrug against resistance on my shoulders. All right, thank you. So that's cranial nerve 11 that's intact. Next, we are going to move on to your chest. So you think you could swing your feet around? All the way? Yeah, all the way. So I can see your back. All right, perfect. So the first thing I'm going to do is just inspect for any signs anteriorly and posteriorly for any respiratory distress, such as nasal flaring, tripod breathing, retractions, use of accessory muscles, cyanosis, or tachypnea, which she doesn't have any of that. So her posterior chest is symmetrical. So I'm just gonna have her take a deep breath when I put my hands on her back and just palpate for symmetrical chest expansion. So go take a deep breath. Okay, which is symmetrical. And then we're gonna palpate for symmetrical tactile fremitus. If you can say 99. 99. Okay, perfect. Next, I'm going to percuss in the intercostal spaces. Okay. And the next thing I'm going to do for the posterior chest is auscultate the breath sounds. If you'll just take a breath every time I move my stethoscope. Okay, the right middle lobe, lateral lymph fields. Okay, and then if you could, every time I move my stethoscope, say the letter E, checking for cacophony. Okay, and then if you could say 99. 99. Perfect, and that's testing for bronchophony. And then the last part is the whisper pectoral test. If you could just whisper 1, 2, 3. All right, perfect. Okay, so that's for the posterior chest. If you could swing back around, and we will do the anterior chest. So we're going to just do the same thing, still looking for the same signs and symptoms for respiratory distress, which there are none.
Here's what I found.
So I'm just going to palpate for even chest expansion. Sorry. Okay, take a deep breath. Perfect. So that symmetrical chest expansion, and then let's do tactile fremitus 99.
99.
Okay, perfect. And let's listen to your lymph fields on the front. Perfect, thank you. All right, so So next from the chest, we will be moving on to the heart. So we will, from here, just listen to the heart sounds at all 5 auscultation points with the diaphragm and the bell. So I'm going to start at the aortic, which is the right second intercostal space. The left second intercostal space is the pulmonic. The third left intercostal space is the Erb's point. Fourth left is the tricuspid. And then the fifth midclavicular is the mitral. We would locate the point of PMI, and for time purposes we won't, but we would auscultate the apical pulse for a full 60 seconds, noting the rate and the rhythm. Okay, so if you could just lay back on the pillow for me. Alright, so here I am just, she is at 30 degrees, and if you could tilt your head that way just a little bit, I'm just assessing here her JVD for any jugular distension, which there is not any. So I'm going to just kind of lay you back flat, just inspecting for any heaves or lifts, and palpating over each of the auscultation points for any thrills. 5 auscultation points. And then we'll repeat the auscultation while supine. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then with the bell, aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, and then for here, for privacy reasons, we won't be lifting up her shirt, but I'm going to move to your abdomen. So for the abdomen, for inspection, we will just note the contour and symmetry of her abdomen. We would start just by making sure that there's no asymmetry or any abnormalities with the contour of her abdomen. We will first we will auscultate her bowel sounds in her abdomen, starting in the right lower quadrant. Right upper, left upper, and left lower. Also auscultating the arteries in the abdomen, so the aorta, the renal arteries, the iliacs, and then the femorals. Okay, next we would percuss, and just kind of looking for any dullness or tympany. And the last thing that we would do for the abdomen is palpate. So we would start by light palpation. Do you have any tenderness? Light palpation, and then we would do deep palpation. So this for the spleen, could you take a deep breath? Okay, and can you take another deep breath? For the liver. Okay. If you'll sit back up and face that way. Alright, so the next thing that we are going to do is I am going to test the sensation in her upper and lower extremity. So if you'll close your eyes and tell me if this is sharp or dull and just which extremity I'm poking.
Moving the right, and it is Sharp.
Yeah.
And the left leg, sharp. Right leg, and it's dull. Left arm, and it's dull.
Perfect, thank you. And then if you could keep your eyes closed, I'm gonna put something in your hand and you tell me what it is. You can open your hand.
Pen.
Okay. All right, and then that is for stereognosis. And then if you'll close your eyes again and open your palm, and I'm going to test for graphesthesia. Tell me what shape I'm drawing.
Circle.
Perfect. Okay. The next thing we are going to do is test your reflexes. So we're going to start with the brachioradialis. The biceps. And go with your arm up to do the triceps. The patellar. And the Achilles on the foot. And then the Babinski on the bottom of the foot. Okay. The next thing we'll do is we're going to do some range of motion and some musculoskeletal strength. So if you will, let's check your radial pulses and your capillary refill. And then let's do your strength in your hands. You could just squeeze my hands. Okay. Strength is 5 out of 5 in the hands. So let's start with the range of motion of the fingers. So just copy me. We're going to do flex, extend, hyperextend, abduct, adduct, and then thumb opposition. And then this rapid movements of finger to finger quickly also test the cerebellar function. And then let's do the wrist. So you'll go flex, extend, hyperextend, radial deviation, ulnar deviation, and then rotation. And then I'm just going to have you push and pull against my arms. If you could just pull, okay, and push. And that's biceps and triceps strength, which is 5 out of 5. And then I'm going to have you push and pull against my arms here with your shoulders. So push, like up, like that. Okay, and then if you pull down. Perfect. So shoulder strength is 5 out of 5 as well. So let's do your elbows next for your range of motion. So you'll just say flex, extend, and then hyperextend. And then we will do your, let's see, we'll do your shoulders. I might have to do those when you stand up. Do shoulders when you stand up. Okay, let's do your dorsalis pedis pulses, and then your posterior tibial pulses, and then your capillary refill on your feet. Another thing that I need to do is just palpate all of your joints for any tenderness, redness, swelling, crepitus, nodules, lesions, or warmth. So the toes, the ankles, the knees, the hips, fingers, wrists, elbows, and shoulders. So there's no crepitus present in any of those. If you could push against my hands with your legs and then pull back towards the bed against them, and that's testing the strength of your knees. And then push against my hands with your feet and then pull up towards the sky with your feet, and then that's testing your ankle strength. So those are 5 out of 5 as well. So let's do your feet visible. Yeah. So let's start with your toes range of motion. So we'll do flex, down, extend, hyperextend, and then spread your toes out for abduct, and then push them back in for adduct. And then, actually, sorry, when you point at your feet down, it's plantar flexion, and then up is dorsiflexion, and then rotate your feet around. And then, okay, yes, I'm going to take you down some. Okay, and have you push out, like with your hips, like outwards. There we go. And then inwards. And that tests your hip strength. Okay, if you'll stand up for me. Alright, so we are going to do range of motion for your shoulders. So just go out, flex, and then down, extend, and then back, hyperextend. And then you're going to do internal rotation like this, external rotation up like this, and then abduct, adduct, and then circumduct around. Next thing we will do is your knees. So we will say flex, extend, and then hyperextend, and then do the other leg, flex, extend, hyperextend, and then your hips. So we'll go forward, flex, and then back, extend. You can go back, hyperextend, and then abduct out, adduct down, and then circumduct around, and then the other leg, flex, extend, hyperextend, and then abduct, adduct, and then circumduct, circle. Okay. Okay, so next let's do the your spine. So if you will just turn that way, just make sure I can see, and then bend forward. As flexion, just noticing the curvature of the spine that has no scoliosis or any curvatures. And then if you could go forward and flex, and then up extend, and then back hyperextend, and then lateral flexion side to side, and then rotation around. And then if you will turn and face this way, I'm going to have you put your arms straight out and close your eyes, and that's a negative Romberg test. And then we are going to do the, if you could just walk, I just want you to walk across, like just regular walk. And then if you'll turn around and walk, tandem walk, toe to heel, toe to heel. Okay, thank you. And then if you could hop on one foot, and then hop on the other foot. Thank you. Okay. Okay, and that concludes the assessment.